Have you ever wondered if all those routine health checkups after 65 are really helping you? Or if some might be unnecessary? Many seniors follow schedules set decades ago, trusting that more tests automatically mean better care. But recent updates in senior health guidelines are showing that's not always the case. Some screenings are being rethought, new recommendations are emerging, and experts are emphasizing smarter, more targeted approaches. Whether it's keeping an eye on your heart, monitoring memory, checking bone strength, or navigating cancer screenings, the rules are changing, and knowing what truly matters can protect your health without adding unnecessary worry. Have you ever questioned whether a test you had was really needed? Share your experience in the comments below. You're not alone in figuring this out, and what comes next might change how you think about planning your health checkups. Have you ever paused and wondered whether all the health checkups we've been taught to follow after 65 are actually doing more for us than we realize? Or if some might just be creating unnecessary stress and confusion? It's something millions of seniors and their families think about quietly, but rarely talk about openly. The truth is, health recommendations for older adults are evolving faster than most of us notice, and what was once considered essential may now be rethought entirely. Recent public health updates have started shifting the focus from blanket testing to more personalized, risk-based approaches, aiming to give seniors exactly what they need, when they need it, without overloading them with unnecessary procedures. And that's exactly what we're going to explore today. Which screenings actually make a difference, which ones can be safely reconsidered, and how lifestyle choices remain the most powerful tool for maintaining long-term wellness. Across the past year, several national and international health agencies have released updated guidance on senior health management. These guidelines now include more structured cognitive assessments, routine blood sugar and cholesterol monitoring, and targeted screenings for those with specific risk factors. For instance, cognitive touchpoints are being added to checkups, not because every memory lapse is alarming, but to detect changes that may truly affect daily living. This approach is designed to help older adults maintain independence while avoiding the stress of unnecessary testing. It's a subtle but powerful shift, moving from a one-size-fits-all checklist to a more thoughtful, individualized plan that focuses on meaningful prevention rather than fear-driven intervention. For viewers, this means that being proactive about your health doesn't have to be overwhelming, and understanding which tests actually matter can reduce both confusion and anxiety. One of the key takeaways from these updates is knowing how to choose the right preventive tests after 65. While it's tempting to think that more screening is always better, experts now emphasize the importance of timing and relevance. Basic assessments like blood pressure checks, regular glucose monitoring, and lipid profiles continue to be vital, not because they're flashy or high-tech, but because they provide real, actionable insights about your heart and metabolic health. Age-appropriate cancer screenings, such as mammograms, colon screenings, or cervical tests, are now guided more by individual risk factors and overall health rather than simply following a calendar. Understanding this balance can save time, reduce stress, and keep your focus on what genuinely contributes to your well-being. It's about being smart, not fearful, and making decisions that are both evidence-based and personalized. Bone health is another area where perspective matters. Many seniors worry about fractures and osteoporosis, and for good reason. Strong bones are crucial for maintaining mobility and independence. But bone density naturally declines with age, and that doesn't always indicate disease. In fact, research shows that a slight loss of density is a normal part of aging, much like wrinkles or changes in hair color. The focus now is shifting from automatic scans and medications to lifestyle interventions that truly support bone strength. Weight-bearing exercises, balance training, adequate nutrition with calcium and vitamin D, and maintaining regular physical activity have all been shown to improve bone health without the risks sometimes associated with overtreatment. For viewers, this emphasizes that maintaining independence and avoiding fractures often starts with small daily habits rather than an over-reliance on medical procedures. It's empowering to know that everyday choices, walking, gentle strength exercises, or adding leafy greens and fortified foods to your diet can make a measurable difference. Memory and cognitive health are top concerns for many older adults. Occasional forgetfulness is normal, and studies show that mild lapses rarely indicate serious problems. Yet overuse of advanced imaging like brain MRIs for minor memory concerns can sometimes create unnecessary worry and lead to further interventions that may not be helpful. Simple cognitive screenings, which assess memory, attention, and problem solving, are now widely recommended as a first step in evaluating changes in cognitive function. These assessments are easy, non-invasive, and often provide enough information to guide safe, practical next steps. Combined with lifestyle strategies, quality sleep, regular hydration, mental exercises, social engagement, and balanced nutrition, seniors can actively support brain health every day. By focusing on realistic, evidence-based steps, viewers can feel in control rather than overwhelmed and make informed decisions alongside their healthcare providers. Heart health is another area where clarity can replace anxiety. Many older adults worry about undiagnosed heart disease, but not every stress test or advanced cardiac procedure is necessary for someone without symptoms. Resting EKGs, regular blood pressure monitoring, and tracking lifestyle factors like activity levels, diet, and sleep patterns can offer important insights without exposing seniors to unnecessary interventions. When concerns do arise, targeted testing is far more useful than broad, routine stress tests for asymptomatic individuals. The goal is not to avoid care, but to focus on measures that have proven value, reducing both risk and unnecessary worry. This approach aligns with current public health guidance that encourages thoughtful, symptom-driven screening rather than automatic procedures. Cancer screenings remain an important conversation for older adults, but the recommendations around timing and frequency are changing. Routine colonoscopies, mammograms, and cervical screenings may no longer be indicated for every individual at every age, and safer alternatives such as stool-based tests, discussion of personal risk, and observation can sometimes be better suited to the needs of seniors. These updates reflect growing awareness that interventions should be meaningful and targeted with minimal disruption to daily life. For viewers, understanding when a screening is likely to offer a real benefit versus when a non-invasive option or conversation with a clinician may suffice empowers them to make decisions confidently and without fear. Across all these areas, lifestyle remains the cornerstone of long-term wellness. Daily habits, consistent movement, balanced nutrition, adequate sleep, stress management, and maintaining social connections have a far-reaching impact on heart, bone, and brain health, often more so than the tests themselves. Walking, stretching, mindful nutrition, hydration, and social engagement are practical steps that support resilience and independence. While medical screenings provide snapshots and data, it's these day-to-day habits that sustain overall well-being and quality of life. For viewers, this reinforces the message that prevention isn't about anxiety or overtesting. It's about consistent, achievable routines that support longevity and vitality. Ultimately, the goal is not to avoid care, but to approach it thoughtfully and informed. Understanding updated guidelines, choosing the right screenings, and integrating lifestyle strategies creates a balance where seniors can feel empowered rather than anxious. By engaging with your healthcare providers, asking questions about relevance, and discussing alternatives, you gain agency over your own health decisions. Sharing experiences, reflecting on habits, and being proactive in daily routines are simple yet effective ways to navigate aging with confidence. So, as you think about your own health or the health of a loved one, consider this. Not every test or procedure is equally necessary, and what truly matters is focusing on the screenings that provide meaningful information, supported by daily practices that strengthen your body and mind. The landscape of senior health is evolving, and staying informed allows you to make smarter choices that respect both your time and your well-being. Have you ever wondered if a test you had was really needed, or if there might have been a safer, simpler alternative? Share your thoughts and experiences in the comments below. Your story could help someone else feel less alone in navigating these decisions. And as we continue exploring practical ways to protect your health, stay with me. There's more coming that will give you a fresh perspective on everyday habits and screenings that truly make a difference.